Bruce, you must have something really good too.
Of course I do. It's Bruce Danielson, and I guess I'm here to entertain you too.
Good afternoon and welcome to your Sioux Falls City Council informational meeting. Today is Tuesday, April 9th, 2019. We're going to call this meeting to order. First item of business is Committee Commission Report. Councilor Starr Staley, Southeastern Council of Government, CCOG, update.
Absolutely, Madam Chair. I'm going to start with CCOG, and then I believe Councilor Staley has a few things she wanted to jump in as well. The nice thing about CCOG is some of the great things that they do in our community. As with both reports I'll give today, one of the important things this time of the year is finishing up last year's 2018 budget numbers, or budgets, and then looking at 2019. So that was one of the things that we spent some time taking a look at the last CCOG board meeting. The other thing was the dues were set for the 2020 year that include a 2.4% increase. And I know that submission, I believe, has either been made to the mayor's office or will be there shortly. The other thing that was presented to us at CCOG was the Comprehensive Economic Development Strategy. And like most government reports, it's 100+ pages. So if you're looking for some light reading, I'll make sure that it's on the city's website. It was a nice tool that put all of the community and regions' economic development tools into one comprehensive document. It's part of a requirement that to receive Economic Development Administration grants and matching funds. EDA, I think, is the term most of us are used to hearing as part of that. So I'll make sure that it's given to staff and it'll be uploaded to this meeting. So that takes me through, and then I believe that we will also be receiving an update of what CCOG did in 2018 sometime in early summer before the budget session. We'll have the director in to go through that part of the accomplishments.
Councilor Staley, did you want to add anything?
Yes, well, and of course there's a lot of things discussed at these meetings, and it's kind of interesting to with the CCOG meeting because you've got mayors and administrators from different communities. So you get their perspective on things. One of the things that I thought was interesting is the housing study. That they're offering grants to these smaller communities to come in and do an in-depth evaluation of what their needs are actually going to be for housing. And they said that they are talking to landlords and realtors. And Mike Cooper actually, she commended Mike Cooper for his time in service of Sioux Falls. And then he said that they do try to do a housing study here every 5 years. So I think that will be very helpful in helping to decide what kind of needs we have for our affordable housing especially. And then she talked about the Governor's House program, and just for the public's information, a Governor's House 2-bedroom is $49,000 to build. The 3-bedroom is approximately $57,000. But by the time they buy the land and put in all of the infrastructure, it raises that to almost $184,000. However, they are offering initiatives to bring that down. I believe she said the end price, because they're giving some paybacks to the people who qualify, it comes down to about $150-some thousand for the new home. She also talked about, Lynn Keller Forbes talked about I believe it was the town of Centerville. It was an interesting topic dealing with nursing homes, because we've heard about my hometown of Mobridge and then Madison recently are losing their nursing homes. And the mayor of, I believe it was Centerville, was there. And they were talking about how she intervened into their nursing home. And with the help of the CCOG institution, they were able to turn this thing around and actually bring it to a profit. And I said, gee, Lynn, it's too bad you're not in these other districts. There's 7 districts throughout South Dakota, 6 districts. And I said, too bad they can't have some kind of an assistance. And she says, well, it's me, I'm here. So the point to me was that it is possible to help these communities. Early intervention is really what is needed. So those are some takeaways that I had. Oh, one other thing, the CCOG organization also for the members, and I think she said they have almost 100% participation in our district, but that they help municipalities write ordinances. Thought that was kind of interesting that they go out and do this for them. So that's my part of the report.
Thank you, Counselor. Next update is Sue. Are any questions on that update? Okay, the next one, Counselor Starr, you have as well, Siouxland Heritage Museum Board update.
Great, thank you, Madam Chair. Again, it's that time of year where we wrapped up the 2018 budget, had an annual report together. Director Hoskins has a report ready for both the County Commission and the City Council, so we'll be receiving that report, I believe, at our next joint meeting. I don't know if we have that on the agenda for this month or if it'll probably be the May meeting when we go through the annual report for the museum. And then a lot of time was spent on the 2020 budget request that has been submitted, I know, to the administration moving forward. As you know, that's a 50-50 split between the county and the city. So the city owns the Pettigrew Museum, where the county has the Old Courthouse Museum, and then we share the Irene Hall Resource Center. So a big part of that discussion is that first year of getting utilities and expenses for a new building. There were some surprises. There were some things that came in a little bit more than what they were estimating for utilities. So trying to get that all on track for a full budget year, spent a lot of the time doing that. And then, like I said, we also took a look at the 2018 enterprise fund that the museum has. The primary funds from that comes from rentals of the facility, so weddings, anniversaries, and different events that are done there. So the museum's in great shape, and we look forward to when Director Hoskins comes in May to really update and go through that entire budget and the activities of the museum system.
Thank you, Counselor. Any questions about that? All right, seeing none, we will move to City Council open discussion. Any open discussion?
Yes, I have something.
Go ahead, Counselor.
In light of the discussion that just came out about purchasing these homes in areas that are floodplains, I did put that on Facebook. I shared some of the media stories about that. And one appraiser in town came on, and they were talking about, well, what is going to be the basis for a repayment or to buying these homes back? And somebody said, well, assessed value, and then another person said, well, that's 70% of the market value for appraisals. And I'm thinking, or assessments, and I'm thinking back when we just did the Board of Equalization, I asked the Minnehaha County Assessor and the Lincoln County what their target is for market value when they set our assessments. And I thought I remembered correctly, but I called Chris Lilla just to make sure. And just so the public knows that when you get that assessment bill from the county, state law requires that it's 85 to 100% of the market value, and he is aiming at, he wants to get between 92 and 94% of market value for your Minnehaha County assessment. But I thought it was interesting because we just had this week of listening to people come in and tell us they think their assessment is wrong. And you know, we had some dialogue and some debate, and when we were doing that, and I was just curious how many of our decisions were being appealed by the county, because that's what, you know, they'll say, well, your board can reduce the amount of the assessment, but the county can kick it back up again. You know how many of our decisions were being reversed? One. So I thought that was pretty, now I don't know what Lincoln County did, but I thought, well, that's kind of cool. So he was very affirming of what we did as a group on that. So that's that report. And also, are you going to say something today about what happened, Councilor Erickson?
Go ahead. You're welcome to.
Well, Councilor Erickson, I tip my hat to her. She organized a tour of the pheasant industries at the penitentiary. A group of us, some city employees went out there. I think every city employee should actually have that tour, everybody in management. All councilors should go on that. But it was very good. We spent about 3 hours there. The warden, Darren Young, is a fabulous man. I felt that there was a great amount of warmth and love, and affirmation coming out in trying to help these people, the inmates have purpose, and in some instances come out into the community to work. But what they were doing within the facility was really impressive, I thought. And so I thought it was really worth my time.
Yeah, it was, I'll chime in, and Counselor Neitzert, myself, and Counselor Staley went today, and I know there's another group going at the end of the month. And it was extremely eye-opening, the resource that we have. I know each of us have expressed an interest in workforce development, and we have a huge workforce waiting to be trained and waiting to re-enter. One of the things Darren said today is 95% of these folks are getting out, 95%. So when we want them, when they are getting out, don't we want them to have the best social skills, job tools? And each of the shops that we went to, it was so fascinating hearing them have great pride in the work that they did, from braille to woodworking to tying widgets together, and you name it, signage, marketing, graphic design. I mean, I just had no idea what to expect, and it was extremely valuable. And just hearing the self-worth of them getting to explain their job of what they do to each of us, I know Counselor Staley was in a great conversation, and it was fun to see them explain to us their role and how excited they are. And they have a lot of flexibility as far as if somebody comes forward and says, hey, I want you to design this brochure to me, they get to design it. They get to infuse their ideas, and they get to help impact what that is that goes out. Some of them were in life. They were in there for life. Others were low offenders. But the ability for them to earn some time to give back, as well as they earn money that they can help child support, they can pay victims, and that's all managed with that. So it's not just going into a big pot of money, but it's a great resource for this city and for our community as we move forward with different jobs. Not that I want to see anybody out of a job, but repurposing maybe some of the things that we do and utilizing them in greater detail. And each of us have some ideas, and Darren's certainly open and welcome to them. So feel free to reach out. And if you aren't able to go on today's tour or next week, I'm sure he would be happy to have you come through. So it was very eye-opening. That's my 2 cents. Anybody else have any open discussion? Okay, we have a very lengthy informational, so we'll move on to our next item, Community Health Status Report. Mary Michaels, welcome.
Good afternoon, Mary Michaels, Public Health Prevention Coordinator with the Sioux Falls Health Department. Thanks for this opportunity to share our latest community health report, which is a result of our ongoing collaborative work with both the Avera and Sanford Health Systems, as well as a number of community partners. We come before you and we talk a lot about public health and what really impacts our health. And this report is the culmination of over a year's worth of work looking at what is impacting our health in the community. And so we know that our health is impacted not only by our health behaviors, our choices we make, but also by our environment. And so we want to look at how does that environment, how can it predict how healthy we'll be as individuals and as a community. So we are all impacted by the conditions in which we live, age, work, play, learn, and we call those conditions social determinants of health. And what you'll see on the screen is some examples of those social determinants. Because where we live impacts our ability to access healthy food, job opportunities, housing, schools, as well as places to be physically active and to make social connections. So we're currently living in an age where our zip code can be a better predictor of our health than our genetic code. In large metropolitan areas around the country, we were seeing that residents just a few miles apart were experiencing different life conditions and seeing different life expectancy, because when they had limited access to healthy foods or transportation options, those can impact rates of chronic diseases like heart disease, obesity, diabetes. And what we learned through our assessment work over the past year is that Sioux Falls is in the same boat. So what you see here is a map of Sioux Falls. And thanks to a tool that was created by the Robert Wood Johnson Foundation, we can actually map life expectancy down to the neighborhood level. So the different shading you see is a representation of life expectancy, where darker green is better, and the more you get to orange and red, those are lower life expectancies. And so right here in Sioux Falls, we have neighborhoods that have a 14-year difference in life expectancy. So right now in the US, 7 of 10 deaths are caused by chronic disease. Many of these chronic diseases are preventable, and many of these chronic diseases are related to those social determinants of health. So by addressing these factors as a community, we can help people from experiencing these conditions that lead to poor health by providing access to those conditions and resources that are necessary for them to be healthier and to have healthy choices available to them. So over the past year, we explored a lot of different health indicators, and those are in the report that you have in front of you. But we're just going to touch on a few of the priority issues that collaboratively we identified through our work. So those priority issues that kind of bubbled up to the top are access to care, behavioral health and substance use, and chronic disease prevention. So I'm going to touch a little bit on each of these three. So even though we have a number of healthcare resources and assets in the community, residents identified access to care as an area of need. And it is important to note that access can mean different things to different people. But in general, it means that you have the ability to understand what health resources are available within the community, to be able to gain entry into the healthcare system at a location where the services you need are provided, to find a trusted healthcare provider, and then to have the ability to pay for the services that you need. But unfortunately, disparities exist in this access, and that can be due to age, gender, race, ethnicity, income, and even geography, as we talked about, where you live. And these barriers can lead to unmet healthcare needs, or delays in receiving care, or financial burdens. So through the resident survey that was part of our data collection, 64% of residents said that cost and access to services were health barriers for them. And 16% said that healthcare had been delayed at least once due to cost concerns. So in the area of mental health, we know that our mental health is essential to our personal well-being because it impacts our ability to care for ourselves, to maintain good physical health. So in that resident survey, when they were asked about their own experiences, 37% of residents indicated they had a past diagnosis of depression. 37% said they had a past diagnosis of anxiety or stress. 12% said they'd experienced panic attacks. And then 6% said they'd been diagnosed with other mental health issues. The Helpline Center, with their 211 number, they issue a community trends report, and with youth, they say the top concerns are suicidal thoughts, relationship conflicts, academic struggles, and then simply struggles with emotional connections or feeling lonely. Over the past year, overall suicide contacts to the Helpline Center increased 34%, and that was from 2016 to 2017. You also see on this slide a little bar chart, and that is related to the opioid overdose mortality, and it compares the US rate with the state rate in Minnehaha County. So Minnehaha County is a little higher than the state rate, but below the national average. And in the report book that you have on page 33, you'll see a series of maps of the United States. And it's just a good quick visual where you can see color coding changes and showing those increases in overdose deaths across the US. Now, fortunately here we are not seeing some of the rates that other places are in the country, but it's a good reminder that we as a community need to be looking at these issues so we don't find ourselves in the position that many other cities in the country are. Binge drinking, that's another area of concern, and we saw this in the 2016 health status report as well. And when you look at national data, and all of this is self-reported information, the national rate has us holding pretty steady at around 20% of binge drinking, which is, you're talking about 4 or 5 drinks on one occasion. But when we asked that question to our residents through the survey during this process, 38% of adults said that they had engaged in binge drinking. So we know that alcohol and substance use are going to remain public health concerns here in our community, just like other communities across the country. So whether we're talking about alcohol or other substance use, there's an impact not only to that individual, but also to their families and to their employers and to the whole community. Earlier, we talked about, I mentioned the life expectancy differences. Our nation actually lags behind comparable high-income countries on a range of health outcomes, including life expectancy, despite the fact that we spend more on our health care. Approximately 71% of the total health care spending in our country is associated with care for Americans with more than one chronic condition. In Sioux Falls, over 2/3 of our adults are overweight or obese, and what we've seen is, and this is something the entire country is seeing, and that there's always more in that overweight category and fewer in the obese, and that has now flipped, where there's a lower number in the overweight category, more in the obese. So our rate in Sioux Falls has gone up since our 2016 report. There's more than 200 diseases that are associated with excess weight, and that impacts every organ of the body, and these diseases are costly. Expenditures related to treating obesity-related disease in our country totals over $480 billion. So research has shown that for a person with a body mass index of 40 or above, which is that obesity classification, just a 5% reduction in weight would decrease that individual's annual health care costs by about $2,000. So more than half of Americans also have one or more preventable diet-related chronic diseases. In Sioux Falls, we've only inched up a bit with our fruit and vegetable consumption, with about 15% of adults that are meeting that daily recommendation for fruit and vegetables. And with physical activity, the recommendation is about 150 minutes a week, on at least, so about 30 minutes a day on 5 or more days a week. In our residents survey, we found that only 18% of residents stated they are active 6 or 7 days a week, with more than half who are active fewer than 3 days a week. So perhaps you've heard the term sitting disease, and this refers to the negative health effects of long periods of sedentary, behavior, lack of physical activity. So one study estimated that the average American spends about 55% of their waking time, or about 7.7 hours per day, in sedentary behavior like sitting. So if you'd like to stand up and stretch for the remainder of this presentation, feel free. Yeah. Another risk factor, hypertension, high blood pressure, increases your risk for health issues like heart attack and stroke, kidney disease. In the past, we have our annual Big Squeeze blood pressure effort. It's actually going on right now. It happens every April. So if you haven't already gone and gotten a blood pressure check, do so, know your numbers. In the past, we've seen a fairly consistent trend that only about a third of our adults who are screened are in the normal range. So in the last couple of years, the American Heart Association has updated their blood pressure guidelines after years of research. It was always 140/90 as your high, and that is now 130/90. The reason they did this was they want people talking about lifestyle factors with their providers sooner, making those adjustments to diet and exercise and quitting tobacco, and those choices that might help them lower their blood pressure, prevent high blood pressure, or maybe make an impact on whether or not they need medication. So we are really looking at those new guidelines, and when we apply our Big Squeeze screenings results, looking at those guidelines, we actually have half of our Sioux Falls adults who fall into that high category. So again, these new guidelines are really placing emphasis on the proactive behaviors that to lifestyle factors like the diet, exercise, and not using tobacco, which is an area of good news in our report when we look at our tobacco use rates in the community. So as you know, 2 years ago, about almost exactly 2 years ago, the city implemented its policy regulating tobacco use on city property. And this has created smoke-free environments in parks and at other facilities. It reduces exposure to secondhand smoke and creates that healthy environment. And when we look at the adult smoking rate in Sioux Falls, from our last report to now, we have decreased from 16.7% to 15.5%. So very good news in that area. But we know there's more work to be done, especially as we look at our youth and the rise in e-cigarettes and vaping use. So still not an issue that we can put away just yet. Looking at these rates of chronic diseases and looking at these social determinants of health, we're prioritizing prevention strategies to address those modifiable risk factors: physical activity, nutrition, healthy weight, tobacco use, and alcohol use. Some research estimates that if 75% of Americans were working toward those 5 modifiable risk factors, our nation could save more than $600 billion in healthcare costs every year. So after we compiled all of this information and selected our priority health issues, we also brought a group together to help us prioritize some strategies. What do we want to do as a community? And you'll see those on this slide. They included development of the triage center, creating more awareness around the issues with behavioral health, increasing the number of residents who are living at a healthy weight, and addressing those social determinants of health and actively supporting the One Sioux Falls framework. Many of the issues that I've talked about and that are included in that report all roll up into these 4 pillars in the framework, and it really provides a great way for us to focus our attention and bring partners together to address these issues. Last week, you heard a little bit about the triage center and mental health when Chief of Staff Erica Beck talked about the city's BHAGs. And I wanted to go into a little more detail specifically on those mental health topics since you asked a question about that, Counselor, and just to kind of let you know what's happening in that particular area. So we have formed a behavioral health stakeholder group with partners from around the country, around the community, and we've been having meetings with them to look at what's the current state in our community. Where do we have assets? Where might we have needs? And then what are some of the strategies that we can put into place? So specifically with the triage center, you will be hearing more about that in the coming weeks from our public health director, Jill Franken. She'll be bringing more detailed information about the triage center specifically for you. We want you to mark your calendars for September 25th. That is when we will be holding a community event really focused on opioids in Sioux Falls. It will have a discussion on the impact of opioids. It will have a local perspective, and then a focus on state and local policy interventions that could be used. So it's going to be a great event. We will get you more information, but September 25th is that date. An awareness campaign around mental health and substance use is in the early stages of development. We're working with local behavioral health and social service leaders in our community to start looking at what that might look like. What messages do we need to share with the community? So there will be more detail to come on that as well. And then finally, specifically at Falls Community Health, over the past 2 years, we have been increasing psychiatry, counseling services, chemical dependency counseling, and medication-assisted therapy. So lots happening just in that one area, but also, in addition to these 4 collaborative strategies, there's just a number of other public health projects that are happening across the country. So this is certainly a small sampling of the work being done. Now, you've heard me say the word partners quite a bit today, and we wanted just to show you a quick picture of who we're talking about. We have so many great partners in our community that have assisted with us in the community assessment process, but in also efforts like the Big Squeeze. We have partners out in the community doing screenings all over town. We have our Sioux Falls Food Council that are looking at some of those nutrition issues. We have partners that we work on with walking and bicycling efforts, our Complete Streets work. And so the work we do certainly would not be possible without all of these amazing community partners who are lending their support. And finally, I want to note that the report that you have in this presentation only touched on a few topics. In those pages, you will find a number of other topics, and we address some of those social determinants. So you'll find information about housing and transportation, and you'll also find information about food security and oral health and so much more. So we know that no single entity can address all of the impacts that impact health, but we know that a community can. So thank you so much for your time. We're happy to answer any questions that you might have.
Thank you, Mary. Any questions for Mary? Councillor Kiley.
Thank you. Mary, 2016 was the first time that a community health needs assessment was collaboratively completed with the Sioux Falls Health Department, the Vera Health System, as well as the Sanford Health System. How did that come about? What have been the advantages? Also, how frequently is the health needs assessment completed?
I'll answer the last question first. So the hospitals are required to do this work every 3 years. So this is part of their IRS regulations to maintain that nonprofit status. So they are required to do the health assessment and then put an implementation plan together that addresses the community benefit. How are they reinvesting in the community? Now, as the health department, we are not required to do this work. We first did a report in 2012 and looked at some of the main health indicators, diabetes and obesity and high blood pressure, and we pulled some community partners together, and that's really where Live Well Sioux Falls was born. As we worked with the 2 health systems on things like the Big Squeeze and other projects, As they were coming up on their next cycle, the Affordable Care Act actually had some statements in there encouraging them or really pushing them to work with a public health entity in this community health needs assessment work. So they had first approached us at the end of 2014 and said, hey, how might this work? Could we come together and instead of having 3 reports about Sioux Falls, have 1 report about Sioux Falls? So we brought all of our teams together and just did some brainstorming about how do we make this work and how do we divide up all the components of the data and the research, and had kind of a core team that came together. And so over the last 2 reports now, Sanford has led the resident survey process, working with a researcher and making sure it's, randomized sampling and all of those things that you want in a good survey. And then Avera took the lead on focus groups and doing key informant interviews. And then on our end, we looked at some of those secondary data sources, CDC and census and behavior risk factor survey and all kinds of things. And then we also pulled together some different sector conversations. So we met with groups from healthcare and work sites and education and other community nonprofits and even our own city departments to utilize some tools that ask questions about what's happening in policy, what's happening just in the environment, to put all of that information together. So it's been a great collaborative effort, and in fact, rather novel. Because we have these 2 competing health systems so close together in one community. And so twice now we have been invited to present at national meetings about this collaborative work that has happened between health systems and the health department. And we continue to have regular conversations, and this no more gets off the press and we start talking about the next time. So, the next report would be, 2 years from now, we'd be collecting data for that report to come out in 2022.
If I may continue. Well, number one, thank you. We are very fortunate to live in a very collaborative community, even though there's competition between businesses and in this case, health systems. So thank you very much to everybody in the health department for helping bring this coalition together. I think it just increases our effectiveness throughout the community, addressing the needs of our citizens. And of course, a needs assessment has identified needs, and you've identified strategies to address those. Do you foresee you approaching the council for assistance in the coming year?
I can't say no to that. As we work with our partners, we're always looking at how do we address these issues? Is it a simple matter of we have resources available, but maybe people don't know about it? So how do we raise awareness? How do we use media, social media, or other channels just to get the word out about what services are available? Tobacco is a great example of, we know that it comes down to individual choices, but when we can shape the environment and create healthy environments, it helps support those who want to quit tobacco. It might, prevent some others from starting. And we know from evidence from other communities that things like policy work. So when we talk about public health, you often hear the phrase policy systems and environmental change. So we look at all the different avenues that could be used to help enhance what's happening in the community. Complete streets policy was another great example. In practice, some of those things were already happening as we were looking at streets project to enhance safe walking, bicycling, even transit access. But we also know by establishing that with the resolution, the policy that was passed a few years ago, it just set that as a priority and kind of directed all of the city departments involved in those projects that we want you to use this checklist, look where we can make some of those, add those amenities for walking, biking, transit, and if something's not being done, why not? Is there an alternate? So, certainly policy is an option, but there are oftentimes, we can go to work sites and just encourage them to change their environment. So a number of different ways to approach public health.
And I think just one more, if I may. I think it's safe to say that we have a good idea what we can do as city government in terms of assisting our health department. And I would like to think, too, that it's safe to assume that the collaboration isn't going to stop with just simply a needs assessment. Could you give us an indication or an idea of how the Avera and Sanford health systems are going to assist in addressing these needs as well?
Sure, and you'll see a little chart on the one-page executive summary that I provided for you. It lists the strategy areas, and then it shows examples of strategies that could be addressed. The behavioral health awareness campaign is one area that we're working on right now, where both are represented in the behavioral health stakeholder group and in the kind of the smaller work group that we're going to be pulling together to look at some of that messaging. And then we're also going to be relying on them to help us carry that message out to the community. So that would be one example.
Thank you.
Counselor Staley.
Mary, first of all, can I call that an opioid summit?
Yes.
Is that, I don't know if you
Certainly,
use those.
yes.
And I don't know if you're planning on this, but I would just put this in on the front end of this, that I would invite Angela Kanicky to be a part of that from Kello. I mean, she has really become the face of that whole issue, so it would be very appropriate to have her involved. And then I'm wondering, and you may not know this, you didn't touch on this, but occasionally we'll hear about the percentage of young people indulging in alcohol abuse. And do you have any sense of how we're doing in Sioux Falls? Is it increasing? Is it decreasing? You know, we're talking about smoking, and I think they've been able to quantify that kids are, for a while they were smoking less. Now I think that might have turned and now they're smoking more. Smoking we're always going to have these things. But as far as alcohol abuse, any idea how that's playing out?
Most of the statistics we've seen aren't at the local level, the same way some of the adult rates are. I know that the state of South Dakota, the State Department of Health, often does youth risk behavior surveys. I'm not sure where they are in their process of if this is the year that survey is being done. And I can't tell you off the top of my head what the current state rates are or what those trends are, but I can certainly look at that. I know that it is an issue that's continued to be watched, both alcohol and other substance use. And as you mentioned, tobacco, yes, youth smoking rates have been dropping, but again, the electronic, the vaping have been increasing quite a bit.
So, okay, so let's go back to the adult rate. How about alcohol abuse within the adult
Yeah,
community?
so what they measure that with is the binge drinking rate. So asking, have you in the past 30 days on one occasion consumed about 4 or 5 beverages? It's actually 4 for women, 5 for men, or other way around. 4 for men, 5 for women. And so the national rates have shown that we've been staying at around 20% of adults who are engaging in binge drinking. But the difference was when we asked that question through the specific resident survey that was part of this assessment work, that's where we saw 38% of adults self-report that they had engaged in binge drinking during the past 30 days.
In Sioux Falls?
In Sioux Falls.
38%.
Counselor Selberg.
Thank you. Thank you for the presentation. I talk about a subject where I think we could probably think of questions for hours. I'll narrow it down to a couple. As far as average life expectancy, I know this study hasn't gone on for years and years, but nationally and as long as this has been going on, how is that trending? Is it holding steady? Is it going up? Is it going?
Nationally, it's also going down.
It is.
We've had, I think, 2 consecutive years now where the U.S. life expectancy rate has also decreased.
And what are they, can you summarize what you attribute that? That'd probably be pretty hard to summarize.
Pinpoint the one factor. Again, when we look at all these social determinants of health, it's a lot of those modifiable risk factors. It's diet, it's nutrition, but it's also what's happening in communities. And every community is a little different. It might be public safety, violence concerns. It could be the impacts of poverty. And how does that impact your access to healthy foods, to transportation options, to healthcare access? So I think that you'd have to dig into each community to kind of see how that then collectively impacts the national rate.
Okay. Councilor Staley might have just touched on this, but I know you're talking about life expectancy in different areas too. When you're talking about alcohol or drug consumption, I mean, did you already answer this with the 38% in that, but are they finding if you do these surveys nationally, are more people let's say in our part of the country that are sitting stuck inside watching it snow 6 months a year, or drinking more and doing more drug, you know what I'm saying? Is it, what's the
Yeah.
percentages?
Well, I can't quote the exact rate or trend nationally. I can certainly find that for you. What I have seen is increases in other communities and other states around the country, that it is not really going down anywhere. And the one thing that I've found that's really come up in a few different studies is how quickly women are catching up to men in that area of binge drinking. And that is something that is happening nationwide.
Interesting. Couple more real quick. When you talk about good news, smoking rates going down, is vaping included in that nowadays?
That is just adult cigarette smoking.
That's what I wondered,
Yeah.
so.
And most of the rates and data that we see with vaping don't come down to the community level quite yet. I think that's something that we'll kind of watch and see what's happening statewide, or if we can get a sense of what's happening, maybe through our school district. And that may be a question that we need to add to the survey the next time around, is asking specifically about the use of those electronic devices. I know that the schools have seen incredible increases at the middle school level as well as high school level.
Yeah, it'll be interesting to see how those numbers, how that ties in with that. And finally, if I could, the obesity thing, is this, so 1 in 3 people are being classified as obese. Is this the general population, or are these people that have chronic diseases and then you?
General adult population.
No kidding.
So it'd be, again, whether it's the CDC through some of their questions that they might ask, or we asked it on our resident survey as well. And it's simply, looking at what's your height and your weight, and then using the body mass index, putting them into those classifications. But that's just without trying to separate out or asking any other sub-questions. That's just a blanket question to Sioux Falls adults. And then, so that was our rate for adults.
Wow. All right, thank you.
Any other questions? Counselor Starr?
Yes, thank you, Madam Chair. Mary, a couple of things, and I missed during open discussion, so I apologize for taking some of your time, but this Saturday, Four Directions is having a meth awareness walk on Saturday, starting at noon. That is speakers and the service, and then the lineup is starting at 1 o'clock. It's at First United Methodist Church. It's the second annual, so we can at least throw the annual in it. We had a chance to walk in Central Sioux Falls last year. And then, like I said, the walk's from 1 to 3, and they do a great job of involving young people and really taking a look at it. In the past week was the anniversary of my nephew overdosing on opioids and dying. And it was one of those things that we didn't talk about as a family. We knew he had a problem. We knew that things were going on. He was in and out of treatment, had some different things, and we have to be willing to talk about it as a community. And I guess that's where I want to kind of lead my next, hopefully it'll get to a question here eventually rather than me just talking. It's what I do. Is that, we've spent a lot of time as a family and with my 17-year-old and my kids, getting them to understand the privilege that they experience here in Sioux Falls. We don't live in the darkest green part of Sioux Falls, but we live in a part of Sioux Falls that does that. And trying to explain to my 17-year-old how good he has it, and the experiences, how his life expectancy and education is one of those things that I spend a lot of time talking and see that as one of the risk factors, that even here in Sioux Falls, you don't have equal opportunity to education. Not every family has the same ability, the same resources to either live in an area of town that has a quality education or as good as some of the other parts of Sioux Falls. And some of that's transportation, some of it's the boundaries and some things that I think the school district is addressing. One of the presentations that I heard at the Oakview Neighborhood Association a couple weeks ago was from Dr. Kirk Zeke, who's the principal at Annie Sullivan. And he also spoke at Kiwanis Club that I belong to. But he talked about trauma in young people and being able to get them that quality education. Trauma as in divorce, just being neglected or abuse. There were 10 that they broke it down into, and that it lowered life expectancy from that early trauma. No matter how you ended up at the end of your life, those early experiences of trauma really affected the outcome. And he quoted a study that they had used to take a look at this. And so everyone assumes that it was inner city Chicago or New York City. It was actually San Diego, that, of upper middle class, people that are affected by trauma in their life things. So it was interesting to, we like to sugarcoat some of the things, and we like to talk good about Sioux Falls. But we have our issues and we have our things that we need to continue to work on. So here I'll get to the question, but in the goal setting, there wasn't any talk about expanding Medicaid and access to health care. We talked about maybe showing ability for mental health. We talked about things, but we've chosen as a state and as a city, by being quiet about it, that not expanding Medicaid to those 150% of the poverty level. Was there a reason that wasn't included in the goals, or is there, the reality of, that's a state issue, but it's not a state issue. It's our individual citizens that have that.
That's a great question. So access, as I mentioned, is a very, very broad topic. So access to some is knowledge about what's available. Access might be cost, whether or not you're insured, whether you have transportation to get to your medical appointment, and certainly that insurance piece or that coverage piece is part of it. So when we were prioritizing, we started with a list of 60 items, and we got it down to 7 by saying what's related, and then got it down to those 3 overarching categories of access and behavioral health and chronic disease. So certainly each one of those is going to have many little offshoots. So while it may not have been the text on the slide, certainly that is part of the discussion about what is access, what does that mean, and then among our partners in our community, who is working on different components of that, and what should we be doing, and who should we be involving in that discussion. So I think certainly it is, been in the discussion as a piece of what access means. And then also just to touch on kind of some of the comments you were making, Counselor, in our report, as we were looking at some of those different social determinants, education is one of them, and those conditions you're talking about, adverse child experiences, ACEs, there is a little bit of information in that education section about the impact that ACEs do have on health.
Thank you. One other thing that I didn't see of the 8 social determinants of health is crime, or living in a crime-free type of environment. Did that fall in as a subcategory of one of those 8, or?
Yeah, and I think, those were just some examples of, there are actually many different, but yes, public safety, or, violence prevention is certainly considered one of the social determinants. Mm-hmm.
I'll get the acronym for ACEs down here before. It just takes me a couple of times to do that trauma I can remember. So thank you very much. The information's important.
Thank you, Mary. Appreciate your time. If anybody else has additional questions, feel free to follow up with Mary. We will move to our next item, the Recycling Education Campaign update. Welcome, Jessica Sexy.
Hello, counselors. Thank you for having me here today. My name is Jessica Sexy, and I am your sustainability coordinator. So we've recognized that having a recycling education campaign is beneficial to the city, our material recycling facilities, or I might refer to them as MRFs, that's our recyclers, and our waste haulers. And so we wanted to provide an update to this initiative that we're working on. We're very proud of our waste haulers and the level of service that they provide our citizens, and also their recycling efforts. Just last week, we announced that the industry locally has achieved the highest regional recycling rate on record at 23.4%. So I want to take a second to just thank our haulers and our MRFs and our residents for continuing to recycle at such a high level. This is especially important given the challenges facing the recycling industry globally, nationally, and locally. Commodity prices continue to drop, recyclers are facing extremely turbulent markets, and labor is a continuous struggle across all sectors in the waste and recycling system. As a community, though, increased recycling benefits us by increasing the life of our landfill, one of the biggest capital investments and environmental liabilities the city has. It also provides local jobs and protects our natural resources. So we're doing a great job with recycling, but we can always do more, and that's why I'm here. In 2018, the City of Sioux Falls issued an RFP for a qualified marketing and branding firm to establish a regional recycling education campaign. The purpose of the campaign was to target users in Lake, Lincoln, McCook, Minnehaha, and Turner counties, all of the counties that are serviced by our landfill. We also wanted to help our waste haulers and recyclers demonstrate the value and the need for recycling to our users through consistent brand identity and outreach materials with frequent engagement across different mediums. The focus of this campaign will be to teach people how to recycle properly, since contamination or things that don't belong in the recycling stream ending up in the recycling stream can lead to landfilling of our precious recyclable material, increased costs for our waste haulers and MRFs, and inefficiencies throughout our solid waste system. We also wanted to encourage greater participation in recycling programs, regardless of our users' attitude towards recycling, their housing situation, the language they speak, or their economic status, since we all as a community benefit from recycling and waste diversion. So we hired AE2S to help us to develop this regional recycling campaign. Research for this initiative started in late 2018 with meetings, engagement with haulers and stakeholders, and a community survey. Our haulers and recyclers are a key part of our waste diversion and recycling process. They are the link that connects our citizens with the final placement of their refuse after the materials have reached the end of their use. They are passionate about solid waste and recycling, and every company has a unique history, structure, and style for their work. When we surveyed the public, we found what I've known all along in this position, that people in and around Sioux Falls truly love recycling. 93% of our respondents had a positive or very positive feeling about recycling. However, it was clear that there is still some confusion on how to recycle properly. 50% of our respondents said that they would benefit from better education on what does and doesn't belong in the recycling bin. So with that in mind, the main focus of this branding effort is to create a recognizable, easy-to-utilize brand, which will result in a consistent visual identity for recycling and waste diversion education. The brand must provide clear messaging that communicates how to recycle and how to reduce contamination. AE2S looked at the survey data and grouped it into emerging themes, which then became the foundation and the creation of our brand concepts. So these were our 3 brand concepts that AE2S developed for us. Concept number 1 is it's easy to make an impact, and this focuses on the impacts of recycling or not recycling and those impacts for everyone in our community. Concept number 2 is the power of one. This simplifies our ask for people to recycle by having them focus on just one item, one change that they can make at a time. And then concept number 3, it's in your hands. This shows that recycling is literally in the hand of the holder or consumer or person in each level of the waste system. The 3 concepts were presented to various stakeholders, community members, and city employees. Components of the 3 messages resonated with different groups depending on where they were in the solid waste system. Those involved in the recycling industry really appreciated the simplification and clear messaging. This group, as well as our haulers, also connected with the concept that humanizing the waste and recycling process is a great way to connect with their customers. Stakeholders outside of the industry, however, preferred the messaging focusing on impact. This group also thought the clear link to this campaign artwork as being related to recycling was very important. The brand that rose to the top focused on how every action has an impact, large or small. This campaign concept focuses on the actions of each individual. The action of putting recycling in the proper bin has far-reaching impacts in terms of the life of the landfill and costs to our future generations. It also has an impact on the local economy in terms of cost savings for our haulers and our MRFs. The negative impact of choosing not to recycle has implications for the community, landfill, haulers, and the environment. Here are some of the key messages that we will build into this campaign. Visuals will be developed that take elements of the "it's in your hands" concept by humanizing the recycling process and showing the process and impact of recycling on our own community at a local level. Concepts of the power of one will be added into the campaign by ensuring visuals simplify the process and the do's and the don'ts. The end result of this campaign and branding effort will be a long-lasting, standalone, sustainable campaign which can be used by all users in the local solid waste stream. A2S will develop this campaign and plan with the intent to maximize our city resources where we can and supplement areas where we may need more assistance. Now that the brand and messaging have been selected, we are finishing up our Integrated Marketing Communications Plan, or IMCP. This plan includes all of the market research, feedback, and work we've done to date, the development of the selected brand, our communications strategy, and a plan to implement and measure the success of this campaign. We will officially launch the campaign this spring. The first things that you'll see from this campaign will be a simplified, easy-to-use webpage for recycling and disposal education. We will also be focused on digital platform pieces to be used on social media, billboards, city scene, etc. In addition, we'll be preparing videos to be used that really show recycling and the waste system in our community, and I've even asked some haulers if they'd be up for that, and they want to be in the videos as well. And last, we'll be rebranding and updating our recycling guide to show the do's and don'ts of recycling. So, city councilors, how can you make an impact on recycling in Sioux Falls? You can help with this effort by sharing recycling information that we put on our Facebook and Twitter account, which is @SFLeadingGreen. Also, survey your constituents. Find out what questions they have about recycling. We'll take any feedback we can get and build it into our campaign. Last, I want to thank you for your time today and your service for the community. If you'd like me to come back and offer another update, I'd be happy to, but I can take any questions you have at this time.
Thank you, Jessica. Councilor Neitzer.
Thank you, Jessica. The marketing campaign sounds like a great thing. Have you thought about working with the haulers, and would they be willing to, because they have natural billboards and it's their garbage trucks. I mean,
Yeah.
would they put decals on there? I mean, I know Pheasant Land Industries, they could probably get you some decals real cheap. So.
I think that's a great idea. Yeah, we're, now that we've built the brand, we're now looking at how we're going to use it. And so if there are haulers out there that would be willing to be a giant moving billboard for us, I'm all for it, absolutely.
And maybe we don't even charge them. I mean, maybe you just give them the, I mean, whatever, or a very nominal fee, and it could have certain slogans and things on there, like, you know, your garbage bill goes down the more you recycle, or, you know, your recycling extends the landfill 20 years, you know, whatever, you know, things like that. So not just using just our modes of our channels, using their channels. So
I really love that idea. And the goal of this campaign are going to be tools that they can use to educate their customers. And so if that's one way that they would like to do that, I don't see why we wouldn't work with them for that.
And maybe promotional stickers on bins when they give the bins out and things like that, you know, slap something on that. There's probably all kinds of things we could do. The other thing is, you know, one of the, it does feel good to recycle, and I think a lot of people do, but I suspect there still might be some struggle of the haulers getting their users to recycle. Now, some of them do incentivize with things like Recycle Bank, and there might be others that do things like that. Is there still, do you have active discussions about what could you do to incentivize as a company? I mean, maybe it's some sort of a deal where, I don't know how big the bonus is, you know, that they get if you divided it by every customer. If you said, you know, if we hit this target, you're all going to get a rebate. Maybe it's only going to be a couple bucks or something, but, you know, whatever. I mean, something in which to incentivize a rewards program, anything, you know. So.
Yeah, we will be definitely looking at all options. That's, you know, definitely on the table. 30% of our survey respondents said that incentivizing recycling would encourage them to recycle more. I thought it was more interesting that 81% said that they recycle just because it's good for the environment. So there may be some users who would be motivated by incentivizing recycling, and so we'll have to look at what we'd be able to do with the haulers given the system as it is. But we also think that if we can educate people on why they should recycle, why it's important, that that's another sector of people that we can get the message across to as well.
And maybe the last thing, I suspect it isn't, maybe motivation isn't the biggest thing. A lot of times it's really the contamination. because we don't know and everybody wants to try to do the most recycling. So if they err on the side of tossing stuff in that maybe shouldn't be in there.
Yeah.
And so maybe how continuing that public education and how the haulers can work on that as well, you know, so, because I think on occasion, you'll even see, sometimes a hauler will put a sticker on a bin or something, you know, certain ones that say, you know, you can't put this in here if they notice or whatever, but,
Right.
you know,
Yeah.
something that operationally, if they could work on that, I mean, they got to get through all of their pickups, but.
Right. And when we surveyed the haulers, we found that contamination, you know, not only adds to more expenses for them, but it also really slows down, you know, the efficiency of their system if they're having to pull things out of people's bins. And so we do really want to focus on just what belongs in the bin. Some of the feedback that we're getting from the haulers is that maybe, you know, on our current recycling guide, we have a whole page showing what not to put in the bin. Maybe we just need to simplify it down and only talk about what should go in there and ask people to leave the rest out. Because it really, you know, it can cause more material to not be recycled if there are things in there that shouldn't be.
Okay, thanks.
Councilor Kiley.
Thank you. Number one, thank you for your efforts. I mean, after all, the volume of our landfill is limited before we're going to have to expand or look elsewhere. So the more we can do to reduce what's going in, the more it extends the life of our landfill, not to mention, you know, just our natural resources are somewhat limited too. So the recycling helps to save in that area, reducing pollution, yada, yada, yada. You know better than I. What % of what is hauled to our landfill are recyclables versus biodegradables or trash?
It's a good question. As part of our waste landfill master plan, we did look at a waste characterization study, and we went through and sampled some loads that were coming into landfill to take a look at what items in there were recyclable. And there definitely are recyclables in our waste stream. That's a fact. And so I think we could do more on the landfill's end at enforcing our ban on recyclables entering into the landfill. As far as a specific percentage, I don't have that off the top of my head, but I can get that for you. I think that we are so focused more on trash ending up in the recycling because it can have a bigger impact on recyclables that should be able to be recycled not getting recycled. So there is more work that should be done, and we can do that on an enforcement level at the landfill, but it is going to come down to our haulers having the tools that they need to educate their customers on what shouldn't end up, you know, in the trash and in the recycling.
And our landfill is a regional landfill. Do we know how well our partners are doing in terms of recycling? I mean, it's got to be greater than just the Sioux Falls effort.
Oh, yeah. Yep. So we license 19 different licensed waste haulers, I believe. And they service the 5 county regions, so they're not just in Sioux Falls. I believe we have just 11 that service Sioux Falls, but there's 19 throughout the region. And so they have to have a license with the city to use our landfill. They have to meet the same recycling standards as our Sioux Falls recyclers. We, as part of this effort, AE2S actually went on a ride along with one of our recycling trucks in town and then one on the rural route. And they actually found that the quality of recyclables on the rural route was a lot higher. That could just have depended on the day or the route that hauler was taking versus what our city hauler was taking. But I think we are doing a great job overall, but we're going to have to, with this campaign, target our messaging differently to whether you live in Sioux Falls or maybe you do live in a more rural community. So it's going to be a consistent, you know, brand and things like that, but how we talk to these different audiences is going to be different depending on where they live or their housing situation, if they're in an apartment or a house, things like that.
Well, we certainly do make it easy for our residents to recycle, especially with single stream recycling. You know, I remember before we had single stream, we used to separate it. Back my household, we still separate it and then dump it all in the same bin. Go figure. And I was thinking along the lines of Councilor Neitzer, you know, what kind of incentives can haulers offer their customers? Usually, if it's something that impacts their pocketbook, it's going to have a greater impact on their participation. But I also know that if you do this on a per customer basis, then it's going to require the hauler to somehow monitor each individual customer, which is going to take time.
Right.
And which isn't always possible. But I think the more you can work with the haulers along that line, I think that will improve our results even better. And I'm sure you've been doing that. I just continue to ask you to continue to do so. But thank you for your efforts.
Thank you,
Counselor Staley.
Well, first of all, Jessica, you made I don't know if it was a slide before, but you just made a wonderful statement. You said to us, and this is, to me, is the essence of what we are about as city councilors, but you said we're supposed to be talking to our constituents, reaching out to them, getting feedback from them. Fabulous. Thank you for saying that, because we need to be reminded of that frequently, I do believe. First of all, I want to ask you a question. If you don't know, you can get me the information, but what do we pay for this consultant study?
For AHUS, for this study, it came out of our existing public education budget. So just to back up, in the past, we have public education dollars from the landfill. In the past, we've used these to work with different marketing campaigns. So whether it be for radio ads or TV, and we'd work with each individual company. So it really wasn't as effective as maybe going through somebody like AHUS who can handle those contracts altogether. The cost for this campaign was $40,000. That's going to cover the research that they've done, building the brand, and then building all the tools. And then, like I said in one of the previous slides, the goal of this is to really be to hand it off to us when they're done, and then we will be able to do with it. If we need to, update things, if the markets change, we need to take something off the S list, we'll be able to do that. We've brought in our communications department right away from the beginning to make sure that anything that they build for us, our communications department can also edit as they need to, add on to, so that this is a sustainable long-term campaign. Once it's built, we won't need to hire a consultant again to redo this every year.
Okay, thank you for that information. And then I was thinking, first of all, I'm hearing you say that this is not going to have any impact, any cost to the haulers.
Right.
It's not going to trickle down.
No.
And because making them take the time to go through each person's garbage individually, we don't want to be putting more of a cost on that. But I was under the impression that, we've really ramped it up as far as the recycling effort in our community. I thought we were doing pretty well with that.
We are doing a great job. Like I said, our recycling rates have continued to increase, but the challenges are just going to keep on getting harder. And so we want to do everything that we can to help them with their efforts. We want to be the public education arm for them so that they don't have to spend any other resources on educating their customers, that we can do that for them, and it can be on a consistent basis throughout the community.
Well, but they still have a burden within themselves to educate us. That you're not going to take that away from each individual company, right? That's still, as their customers, I think they need to explain to us what goes where.
Right, yep.
And we have new customers, and people are shifting around from company A to company B all the time. So I think that's a very positive thing. But I was wondering if maybe you could even put something in the water bill. And maybe you do, those are the things people do get their hands on.
Yes, yep.
And that doesn't cost us anything. We don't need a consultant to even help us with that, right?
Right. Once the guide is developed, the recycling guide that will show people how to recycle properly, we've already talked to utility billing. It'll go in a water bill, and we actually do that every year now. But when we revamp and rebrand, we're definitely going to do it again.
Okay, thank you.
Thank you.
Counselor Starr.
Jessica, a couple of things. In the last year, what is it, about half of the plastic and cardboard that we recycle in the United States was getting shipped overseas. And now with the trade war, the markets have gone away. And you see it in a lot of communities where the plastic's piling up. There's warehouses full of cardboard. Some communities have even gone back to, once it's recycled, and it just goes back to the landfill. So give me an idea of where Sioux Falls is at in that process.
We have so there's two material recycling facilities in town that service the 5-county region and beyond. There's Millennium Recycling and Advanced Recycling. We've brought them in through every step of this process to make sure that they have a voice as we build this campaign, and that it will reflect what they can accept at their facilities, because not every facility in the country can accept the same types of material. And so we've brought them in. They're both on board with the brand that we've chosen. Our next step will be to bring them in and our haulers in and talk about what materials we're going to say can be recycled and that we want to encourage people to recycle. The best way for our recyclers to continue having a healthy, thriving business is to get as much clean material through their facility as quickly as possible. A lot of people don't understand that once your recycling gets taken to the recycling facility, it gets dumped onto a conveyor belt, and the first step in our recycling process is having individuals actually pull trash out of the recycling stream. That can slow operations way down, increase labor costs, and make the whole system inefficient. So the best way that we can help our recyclers, and this is feedback that they've given us, is to address the contamination issue. If there's too much trash in there, we're going to see more and more recycles end up at our landfill. So that's probably the number one way that we can help them.
So right now, I know that we invest tens of thousands each year paying for electronics recycling because the market isn't there. So, and we limit the amount of recycled electronics that we'll accept as part of our recycling centers. Are we paying anything for plastics? Are we subsidizing that market to haul them versus burying it and, once it is recycled and then going back into the landfill? Or have we gotten to that point where they've asked for a subsidy or additional ways to recycle the material?
Nope, we're not subsidizing plastics recycling.
Okay. Do you know what, roughly off the top of your head, what we do for what we subsidize the electronics recycling? Trying to remember the amount too, and it was hard because there's been a number of people that want to drop things off, but they're over their limit or will only accept one item, and they want to do the right thing, and the next thing we know, then they end up, especially at multifamily type of places where the landlord will see electronics when someone moves out, and they want to bring it to the facility, and we won't accept it from them because of the cost of recycling those things. So. Hopefully that'll maybe be something we take a look at. I know that pricing changes quite a bit in what we're willing to do, because it seems to me that, it's one thing to bury cardboard that may biodegrade after a while, but when we're putting electronics into the landfill, we're not going to capture any methane gas of those electronics breaking down, at least not in our lifetime. So thank you.
Councilor Staley, go ahead.
One more thing. I thought that these haulers were fined if they're caught. I thought there was I heard one guy say, it was kind of weighing heavy on him because, so there already are things in place to incentivize them to get it right.
Right, so the industry sets our recycling goal each year. So last year in 2018, we take the totals for MSW and recyclables that all of the haulers brought into the recycling facilities in the landfill, and we calculate our recycling rate based on that. So it's however the industry performed. So last year in 2018, the industry performed 23.4% was their recycling rate. So that becomes the goal for 2019, and haulers have to meet 80% of that. So, oh boy, 80% of 23.4% is what they'll have to meet for their recycling rate, or they're fined $1 per ton that they hauled to the landfill the previous year.
So how are you going to, is this going to impact that in any way?
No, hopefully it will help to improve recycling for all of our haulers by providing them these recycling tools that they can give to their customers and encourage recycling for their customers. It should hopefully bring that recycling rate up even higher.
Councilor Neitzer, and then we're going to move on to the next presentation.
What is the status of, I'll just call it commercial, like for example, Walmart puts all their stuff in a dumpster, or the restaurants. Is there any checking of that, or is it just all go straight to the landfill?
So commercial businesses, per our city ordinance, have to offer recycling. And that can either be single stream recycling or dual stream recycling. So a lot of the commercial businesses that you're going to see in town are going to have cardboard only recycling. That's because they're going to not have that contamination issue. It's going to be clean cardboard, which there is a market for. And so a lot of our commercial businesses have cardboard only recycling. They can work with their hauler to have a smaller bin for single stream recycling if they have a lot of like pop bottles or aluminum cans, things like that. In our restaurants, you're not going to see a lot of recyclable material other than cardboard. Whenever I go to, I don't want to say the name, but there's a fast food company in town that when you go and dump your tray, they have a recycling bin. None of that material is recyclable, and so all of that is going to end up in the trash anyway. So we work with our haulers, by them having to meet the recycling standard. They are incentivized to be offering recycling to their customers and to work with their customers and identify what their needs are for recycling and waste service. So if cardboard only is going to ensure that they get more recyclables and that cardboard is truly going to be recycled, we've worked with them on that, and that seems to work really well for a lot of businesses.
Okay, so they typically use a lot of product that isn't recyclable anyway. Like that, like the soda cup, it's sort of cardboardy, but it's glossy. Is that not recyclable?
That's not recyclable, and it's tricky too because Millennium Recycling can now take like paper coffee cups, but Advanced can't. So it's going to depend on which hauler you use, and so it's not something that we're going to push on, material specific basis. When we develop our Yes Guide, we're going to be looking more at broad things that both recyclers can take.
Okay, thank you.
All right, thank you, Jessica.
Thank you.
Appreciate it. And as always, feel free to reach out with additional suggestions and comments. Thank you for your efforts. Our next item is the Housing Summit. Welcome, Shelley Unruh. Housing Manager, it's your debut.
Wonderful. Councilors, it is my privilege to be before you today to present Sioux Falls' first Housing Summit. And I can't think of a better way to introduce this Housing Summit to you than a personal invitation and welcome from Mayor Paul Tenhaken.
Hi, Paul Tenhaken here. A place to call home is one of our most essential needs for our residents. Finding a home that is not only affordable, but also accessible to quality schools, parks, healthcare, transportation, and healthy food options in a safe neighborhood is a basic need for all of us. As a community, we can collaborate and coordinate to improve the lives for many who struggle to find accessible housing. Please join me for the 2019 Housing Summit to engage in a collaborative, solution-based discussion on how we can connect public and private resources to deliver housing opportunities for working families.
The Housing Summit is scheduled for May 8th at the Downtown Holiday Inn. The example before you on the slide is the invitation that is going out today to constituents that we would like to engage in conversation at the Housing Summit. Included in that invitation is that welcome message that you just viewed from the mayor. Who we're targeting for the Housing Summit are all of those that have a stake in housing within Sioux Falls. So we have developed a list of real estate agents, developers, nonprofit organizations, property managers, property owners, and other organizations that support those industries to engage with us in this important housing discussion at the summit. The registration fee for the summit will be a $20 registration fee, and also included is a public hearing phase that is free to the public to attend, and I'll show that to you in the agenda. So if you look at the agenda, we have a very busy schedule, but one that is going to be very open, collaborative, and a good opportunity for people to provide feedback and dialogue and have solutions-based discussions on important housing needs and trends within the city of Sioux Falls. You'll note at the bottom, towards the end of the day, we have 2 public hearings incorporated into the Housing Summit. Typically in the past, the housing, or the hearings that have been held for the Housing Division have been lightly attended. And because we are already engaging in a meaningful solutions-based conversation, we thought this was a great time to incorporate that public hearing phase and another avenue to get out and promote to the public that we are having a public hearing on housing. The Housing Summit is coming in a timely fashion for what we're doing in the Housing Division, because we are approaching the need to do our next 5-year plan, consolidated plan for HUD. So it's going to align very nicely in us gaining feedback as part of that consolidated plan process. To dive in a little bit into what each discussion is going to be made up of, we're going to have 3 panel discussions, and the first one is just going to be education and awareness on some initiatives that are happening in housing within our city. And so we have some local experts that we've invited that are doing some wonderful things in our community with respect to housing. In addition to these local experts from individuals and organizations, we're also looking outside of our market to see if we can bring in others that are doing creative things in their communities. Specifically, we're targeting the Veterans Community Organization out of Kansas City that is developing or has developed a tiny home community for their homeless veterans in Kansas City. We also have a work group within the city of Sioux Falls that's part of the Onward Leadership Program that is doing a study on veteran tiny homes and actually modeled them after that Kansas City group. So getting Kansas City group to come here to be not only participate in this panel discussion and share with our constituents about what they've done in their own community, but then capitalizing on bringing them to our town and giving them an opportunity to meet with the individuals that are working on that project through the Onward program as well. So really leveraging them coming to visit, in addition to the local folks that we have that are doing great things in housing. The next discussion will be focused on owner-occupied, discussing what are the challenges, the opportunities, and the trends that we're seeing within the Sioux Falls market. This will be led by a facilitator. We'll ask some leading questions, but then the public that are there participating in the panel discussion will be able to engage with our panelists and ask them questions about how they view how we can get involved and really engage in that dialogue. So we'll have that same discussion then for the rental housing market as well. So again, we'll bring up another panel of experts that are working in rental housing here in Sioux Falls to have that same discussion about what are the opportunities, the challenges, the trends, and how can we make a difference within rental housing in Sioux Falls, especially since 38.8% of Sioux Falls residents live within a rental housing unit. Then, as part of after lunch, we will have our public hearing phase. This is free and open to the public, and we will encourage them to participate. This is part of what we are asked to do through our consolidated plan through HUD in continuation or rewriting of our 5-year plan. Normally, who's come to these public hearings are those nonprofit organizations that receive a benefit from the Housing Division and funding. So this is a great opportunity to not only bring those same organizations back, but have others that might have additional input as well. And what we'll do to help foster input is we're actually going to design activities that will get them up around engaging, interacting, and being able to provide feedback on what are some of the important initiatives or the greatest needs in housing in Sioux Falls. Another way that we're going to glean that information prior to the summit is we've actually developed a survey that will promote in addition to this summit. So after you register for the summit, it will thank you for your registration, and then it will send you to a link where you can complete the survey. So by the time that the summit happens, we'll kind of have a good idea through some of that feedback what maybe some of the most important needs are rising to the top, and that will give us an opportunity to address those and have a dialogue about those at the public hearing. So that will be at 2 and 5:30. We'll still stay at the downtown Holiday Inn for that public hearing phase. The other component, which I am very excited about, is the opportunity for those that come to the summit to engage with the nonprofit organizations that are working in housing. So far, we have 15 organizations that have all signed up to be represented at the summit. So we will have the room lined with these organizational tables where you can go during your breaks, during the breakfast, or during the lunch, or in between while you're waiting for the public phase, to have an interaction with these organizations, learn about what they're doing for housing and how they can grow or how you can get involved with their organization. So it's just a really great opportunity for each one of these organizations to promote what they're doing in housing, what their needs are, what their impact is, and how we can do more if we work together. And at this time, I'd like to take any of your questions with regard to the Housing Summit.
Nice work staying on your timeline. All right, any questions for Shelley? Councilor Starr. I was going to say, can't let her off that easy.
I was going to say, I wouldn't do that. I guess one of the things that I guess I see when I initially hear about this is, why didn't you choose a Saturday when people who are off work and have a chance to be involved in the process?
I guess we didn't really look at a Saturday because we were looking at really targeting for the initial phase of the summit, those stakeholders as far as the organizations, developers, contractors, all of those things, not wanting to take away from their time and family. We just landed on a Thursday, not for any particular reason, I guess, just kind of the way it landed. And that's why we have that 5:30 time, to make sure that on their way home from work that they do have, you know, just the general public, because we want to get their feedback and input as well, that they're able to come and attend and provide that feedback. We're also going to provide ways that you can engage with us online. In addition to that survey, there will be a call to action card that's included in the agenda packet. So everybody that attends the Housing Summit will have a call to action card saying, you know, how is it that they're interfaced with housing now? How do they want to get involved? And can we contact them?
So basically, it's an industry event. It's not for people who need affordable housing.
No, it's for both, because the industry event will focus on how industry can help us partner and leverage and grow our dollars and make more impact with dollars that we have. But the public phase is where we can talk to the folks that are actually utilizing those housing benefits, working in the programs, staying in those homes. So this will be the 5:30 session or the 2 o'clock session, whichever one they can make, will be that opportunity to do that. And then we'll also incorporate online tools where they can engage with us that way too, if they're not able to attend the summit.
So if I can, just one more. Is there a scholarship program available for people who can't afford the $20, or can they skip lunch and come to the rest? I'm assuming that's what the $20 is, to cover lunch.
Yeah, the $20 is to help cover the cost of the breakfast and the lunch, but the public phase is free. So they don't need to register to come to the 2 o'clock session.
But if they want to come to the rest and can't afford $20, then what do they do, or how do they? So we haven't done a scholarship, so they'll figure out a way to come with the $20 to.
We haven't done a scholarship for it, but it's definitely something that we can look at. We do have plenty of time before the summit that if we see that is a need that arises, we can absolutely look at it, providing that.
Perfect, thank you.
Any other questions?
I just have a comment.
Sure, then I'll go to you.
I'm sorry, I didn't.
That's okay. Go ahead, Councilor Staley.
No, again, I guess hearing him say that, I'm going to echo that I think something like this should be open to the public. Maybe don't come in for the food, if that, pay extra for that. But when we're having these discussions and these dialogues, again, I think average citizens should be able to wander in and out of this and listen to the discussion. Is it going to be videotaped?
I'm not sure if it will be videotaped, but one model that we did look at in the creation of the summit was we looked at other communities that have done summits before just like this. And their costs were quite significantly more than ours will be. And similar to the Win and Workforce Summit that was put on by the Development Foundation, they also had a cost to theirs as well. So we were looking at a way that we could make it affordable and attainable for our first ever summit, but also include the option for the public to engage with us, which is why we have that public hearing phase. And many of the speakers that are going to be presenting during the day are represented with organizational tables at that public hearing phase too. So there will definitely be opportunity for the public to engage in different ways.
Is the media going to be invited?
Yes, we are going to be creating a media plan for the summit.
So once again, if the media is being led into these meetings, I think the public should be able to come. That's where I would weigh in on this, that this should be open to the people to come. Because it's not going to be videotaped. They'll get smidgets of what the media might be reporting, but the citizens aren't going to be able to hear the dialogue. If I can't go as a council member, I won't be able to hear the dialogue either, because I teach on Thursdays, so that's not a good day for me. So then we're kind of left out of this important thing that all these panel discussions, right?
Yeah, I mean, we can definitely look at having the summit videotaped as well, so that folks that aren't able to attend can see it. I don't see a problem with
Well, I mean, what harm would that absolutely do?
There is
I
no
mean,
harm
if
in
we
doing
can
that.
put these sky cams up to show what the falls is doing and the Skunk Creek, I mean, we've got these what are they called? These scan things, scams. What is that called? Camera scams? What's that thing, Pat? What is it?
Skycam?
A drone?
No, they've got those video cams up there. Yeah, I mean, we're doing all sorts of things with technology, so I think taping these things and putting it on the city's website would be really a good step towards transparency.
Councilor Selberg.
Thank you. Congratulations, by the way, on your new position, and welcome.
Thank you.
I do think this is a wonderful idea, and just to be clear, it's my understanding this is open to the public, and they don't have to pay to get in, or am I misunderstanding that?
Yes, it is correct. We do have 2 public phases of the summit at 2 and 5:30, where they can come in and engage in conversation where we talk and address the housing needs of the community. And there will be organizations there available to be able to answer questions or provide them with information of resources that they may not have been aware of before. So that's why we built in that nonprofit component. So that folks that are not aware of the different resources that we have can really tap into those and engage in those while we're having those discussions.
Okay. How have you been promoting this long, or are you just rolling this out today, or what kind of?
The invitations just went out today, so you'll be seeing a lot more about the Housing Summit in the coming days and weeks leading up to the event.
Are you hoping to have this be an annual event, or maybe biannual, or see how it goes the first time, or?
I think that housing is an important enough topic that I would like to see this as definitely an annual event. And it's a great way for us to really gauge how our programs are doing within the city and the programs that we support outside of the city, and see if we need to continue to put emphasis in one area or another, or if we need to refocus. So getting that input continuously on housing, I think, is important. And we're a growing city, and every year we're going to be accepting in new citizens. So it's important to stay on top of that through meaningful conversation and feedback. So I think an annual housing summit would be a great thing to incorporate, and I hope that this will be the first of many successful housing summits to come.
Yeah, I think we definitely need more discussion on it, and it's a step in the right direction too. It can only, you have the first one, you can certainly shape and improve it and go from there as well. So anyway, thank you.
Thank you.
Councilor Sale.
Shelley, thank you very much. I appreciate the fact that you've put this together in the short time you've been there with the help with the administration. I think it's something that's long overdue, and it's something that we certainly do need to look at every year as time goes by. I, for one, appreciate the high level that the first meeting is going to take before we get down to the individual cases that might need to be addressed. And I look forward, I just want to say, as you go forward in your position, you might be overwhelmed with questions at times. Certainly reach out to those people that have been prior to your position or other people that will help you out. And the council will be here to help you be successful also.
Thank you, I appreciate that.
Counselor Brecky.
Yeah, I just want to add one piece of information to that, and you're probably aware, you may or may not be aware of it, but in attendance at the National League of Cities and the National Congress of Cities, I have learned that the housing issue has gone from number 6 to number 1 on the national agenda as the number 1 issue for cities in the last 6 years. So it's migrated to the top. So all cities are dealing with this. So I would just, point that out to you as well. National League of Cities has done a lot of work on some modeling, and there's a lot of programs out there. So that's a good resource because the city of Sioux Falls is a member to that organization. So, as a new employee, know that they have a lot, they've done a lot of work on that, and that could be a good resource for you. But in light of that, I am also extremely, feeling positive about the way you're approaching it, and would look forward to seeing it as an annual issue until such time as it's no longer the number 1 issue. So thank you.
Any other questions? Thank you again for being here. I look forward to this as well, and I'm grateful for the time that talks about leveraging different resources of those that are already doing some of the great work in our city and how we can work together more, as well as engaging. So it's really multifaceted, and I appreciate that about the take on this summit. So thank you for all of your work, and we look forward to hearing back from you again soon.
Thank you for your time.
All right, we will move on to the next item, and that is Sioux Falls Area CASA Program Update. Welcome, Stacy Teason, and your awesome red cape.
Good evening, councilors. Thank you for letting me be here. I am Stacy Teason. I am the executive director of Sioux Falls CASA. This is my first time being in front of you since I resigned from my position last June, and it's pretty interesting the topics that you guys are talking about. So social determinants of health, love these, and of course housing summits are always a good idea. So I know I have 5 minutes. I just wanted to touch base today because it is Rare Blue today for Child Abuse Awareness Day, and it is also April, so it's Child Abuse Prevention Awareness Month. So it's a great time just with everything. And then our Red Cape event is our one of 2 fundraisers that we do every year. So all about town, wearing capes and working on things. But when you look at the stuff that you guys have been listening to today in regards to social determinants of health, it plays in perfectly with what we do here at CASA. CASA is court-appointed special advocates. We are assigned by the judge to work with kids who've been removed from abusive home environments to work to get them back home as safely and quickly as possible. Unfortunately, what we're seeing is a lot of issues in regards to drugs, not alcohol so much anymore. That used to be a bigger thing, but now it's mostly meth, opioids, and issues like that are making it very hard for families to get reunified. Some of that, of course, is because the parents are getting incarcerated and serving time, so you can't really have a functioning family unit if there aren't any parents there. But the other piece is just the sheer volume. I mean, we just look at numbers. Our numbers for last year, we had 542 children referred to our office for assistance. We are 100% volunteer driven. Our staff work to support those volunteers. We had 255 kids that we couldn't assign a volunteer to last year just because of that sheer growth. That growth is actually 60% increased in 3 years. 60% more kids are experiencing abuse and neglect in this community in 3 years. And with that, then, just starting our numbers from the beginning of the year, from January to the end of March, we have had a 40% or 40 more petitions filed with the courthouse for abuse and neglect than the same time last year. It took us till June last year to reach the same number. So when you're talking about trauma and things that people are masking with their uses of drugs and alcohol, this is where it's coming from. And when you look at all of the things that social determinants play a part of, this is the core piece that we need to address: the behavioral health, the trauma that kids are experiencing when they're little. Because these cases go all the way. They're taking 16 months or longer for them to get processed. And when kids are removed from homes, that's first the most important, most traumatic experience. So CPS, or Child Protection Services, has done a great job with not trying to get them removed in the first place. They have safety plans and present danger plans, and everything is being tried before kids are being removed in the first place. But sometimes that imminent danger is so great that they have to be removed immediately, and that's what the law enforcement officers do for us. So with that, I just wanted to touch base, share with you the sheer volume of kids experiencing abuse and neglect in this community. It is frightening to me because the things that our kids are experiencing are not just, oh, mom spanked me. It's very violent, it's very ugly. And we read these petitions every day. My poor staff, I admire them because I'm a staff of 9, 5 of which are full-time and the other 4 are part-time, and they all are there to support their volunteers working with cases. And those volunteers are most of the time folks who've never experienced or been a part of abuse, neglect, poverty, homelessness. So they're learning firsthand what all of that looks like. And so from that standpoint, we have a training for 12 new volunteers starting on Friday. They'll go through 30 hours of training, and then we do those trainings quarterly, so our next training will be in July. But ultimately, what we do in trying to get kids back home really is reliant on the social service programs in the community and everyone working together. So we're one Sioux Falls all together, abused and neglected kids too.
Thank you, Stacy. Questions, Councilor Neitzer?
Can anyone be a volunteer? What is the time commitment, and what does volunteering look like? What do I do as a volunteer?
Yes, these are not 5-minute questions. Anyone can be a volunteer if they're over the age of 21 and they don't have any substantiated abuse or neglect charges against them. So if you are interested, the application's online. You can just submit your information. It is time intensive, but 65% of our volunteers actually work full time, so it's possible. And that's why my staff are so awesome, because they'll take calls at night. They'll work on the weekend to support that volunteer, because if you're hearing a kid disclose something really yucky, you want to be able to debrief with your case manager as quickly as possible. And so my staff are fabulous with that. What we say is a 10 to 12 hour commitment per month, because you need to meet with all the kids involved with the case. But then we also ask you to be involved with everyone. You end up becoming a giant cheerleader for the whole family, because moms and dads are most of the time victims of abuse themselves, which is the whole generation repeat, and why social determinants of health become so very crucial. So I would say 30 hours of training, and then just determining that this is something that really pulls at you, because if you do this, you will never be the same. And we hope to keep our volunteers the whole time, forever and ever and ever. Jean Beto is one of our volunteers who just 22 years this month. So if you have a passion for it, you will love it forever. And even if you don't and you make it through your end of your case, will have impacted somebody's life forever.
Thanks.
Councilor Sober?
Thank you. So tell me again, the CAPE, the candy bar, what are we?
The candy bar is just because I figured you guys would be sitting here for a long time tonight. Stats for our office. We are celebrating 25 years next year, so this is our 24th year. Those are stats on the back for what we've served. Our volunteers appointed to the office, the number of kids that have come through, and then the number of cases. So this year, again, the volume, and when you look at that, when I say 542 this year, there's 3,600 kids basically on that wrapper. That's a huge increase over a 24-year period, just 1 year's worth of kids. So that's what that is. And then the other thing is our new strategic plan. I'm just pretty proud of it. So if you have spare time and you want to do some additional reading, we're serious about being partners in the community. We know what we do works. It's time tested. It's been around since 1977 when a judge saw a need for it in Seattle, and it has continued to grow. There's 1,000 or so CASAs across the country. There are 6 CASAs in South Dakota. We serve Minnehaha and Lincoln County. And so our volume, of course, is bigger just because we're a bigger city, but the other communities then struggle because they travel. So one of the CASAs covers 14 counties. And so trying to recruit volunteers and get your volunteers to get to court and that sort of thing is a lot of time, whereas we have a lot of volume. And Rapid City has had a significant increase. So Pennington County CASA is just, they have more kids waiting than we do, simply because, one, they're smaller. They're 55,000-ish in their core area as opposed to us. But they also then have a bigger meth problem and a lot of traffic back and forth from their community. So,
Well, thanks for the update. It's good to see you, and thanks for the sugar.
You're welcome. Thank you.
Councilor Staley?
Stacy, just welcome here. I hadn't had a chance to say, how much I appreciated what you did as the homeless coordinator for our community. And best wishes to you in this position as well.
Thank you. Thank you.
Councilor Brecky?
Again, just a brief statement. I bring just watching you brings back a flood of memories for me. I started my career out of law school as a deputy state's attorney at Minnehaha County when sexual abuse and domestic violence came out of the closet. And just to put a reference point to you, so that had been 1981 through 84. And in a 3.5-year period, we had 60 cases. And we thought that was incredible. And each one seemed worse than the one before. And it was all kept a secret. It was a dark secret, and it just exploded on the scene. and there was no CASA, and there was no victim witness assistant. And I remember, because I was the only female criminal prosecutor at the time, and most of the victims were little girls, they all landed in my office, and I said in that period of my life, I was counselor and counselor. I mean, I was a lawyer, but I was trying to play a counselor, which I wasn't prepared for. And, you know, I remember it was after I left that, you know, CASA and some of those other things came around, and, you know, a lot of things happened in that 4-year period that I was there. But I've always just felt like that was huge when CASA came involved and undertook that process, because we were so inadequate in having anyone to really care for the children through that process. And it's such an intimidating process for a child. So never, you know, undervalue what you do. I mean, it's I just want to, you know, just a reminder about what you do and how important it is. I know that you know that, but I remember a time when it wasn't there. So, you know, continue the good work, and I'm just astounded and just terribly saddened by the fact that it's increasing so rapidly, because at that time we thought if we provided counseling and we had a victim witness system and we got them through the system and people knew it was wrong, it would stop.
Right.
And so,
Counselor
you know,
Starr talked about it.
it's hard to see it increase.
It's ACEs all the way, adverse childhood experiences, and the more of them you experience, the likelihood of you having an addiction or substance abuse problem as you get older is huge. And so prevention is key. Prevention is the only solution. And so we can do this where CASA comes in. We're not exactly prevention because there's already been abuse that's happened, but if we can prevent it from happening again, there's hope for a bright, bright future.
Thank you for your report.
Thanks.
One question, if I can. Talk a little bit about your funding. I know we said you had 5 minutes, but we get to ask questions. So
okay.
Talk a little bit about your funding, because I know that the Red Cape is a fundraiser.
It is, yes.
But how are you funded, and where does that?
Okay. Our biggest dollar amount comes from United Way, so we're incredibly grateful for the Sioux Empire United Way, which then is a lot of the donors in our community. That's about 20% of our budget. Then we have some a CASA commission grant, a court improvement protection or court improvement program grant, and then we have a Violence of Crime Act grant. The rest is all donors. So roughly 70%, so if you include United Way, 70% of what we get comes from local donors and people believing in the mission and the work that we do. So it's huge. This fundraiser, we're hoping to raise $50,000. There's nothing to it other than an opportunity to wear capes and be a superhero for a day. We really tried to reduce expenses with that, so it's not a plated dinner somewhere or a location that you have to get a ticket for. It's just simply all online. And so if people are willing to donate, you can just go to our website, SiouxFallsCasa.org/redcape, and then there's a link there to donate. But every dollar we use goes right back into the organization. And truly what we do, kids, when you read these petitions, the first couple times I read, the first petition I read when I started this job in June was a kid I worked with when he was 16. And I just couldn't even, I'm like, this might not be the right job for me because his kids have all been removed and he's 32 years old. And you're just, okay, but I can do this. And they just keep coming and they don't stop. I signed 7 of them yesterday. And so, I mean, and it's a whole court process, so they might have been all week long and they come on my desk today because it's when the judge gets to them and the state's attorney's office gets to them. But they're bad. They're just bad. And when you throw intravenous drug use and you throw, you know, kids that are pulling needles out of mom's arms and covering her with a blanket because she's passed out, just the stuff that we read, that the staff read, that the volunteers are willing to take on because they get to choose the petition. So it's not like we're saying, here's one with 16 kids, good luck. It's you pick the one that you think works best for you, that you think you can work with. And so we have amazing volunteers. I'm so grateful for them. We currently have 83 of them. We'll have, hopefully, with everyone graduating, 12 more, so 95 of them. But we have 118 more just today in the drawer that could use a volunteer.
Thank you for what you do. I appreciate it.
Thank you.
Counselor Starr.
Stacy, do you work with kids that are also in the federal court system, or is this just the state? So
us,
the
yep.
kids in the federal system are...
If they're with the Department of Corrections because they are in trouble, then if they have been removed from the home environment, there might be some different stuff that happens with that just because of long-term placement options. But for the most part, we don't really have anything to do with the federal. We're just Second Circuit.
I would tell you the need is there. I've experienced it firsthand, and probably could have used your services and didn't reach out. And I probably kicked myself a little bit for that because we were in a situation where exactly what you do could have helped. So I'll, because you're not looking for more work, but the kids in the federal system that have been removed from their homes are in the same situations, and same things that you're seeing in the Second Circuit are definitely there on a federal level as well. So
It's heartbreaking for me because I look at it from the standpoint of kids aging out. Just our local statistics say we have 65 kids between the ages of 15 and 18 that are going to work their way through the system because mom or dad are pretty sure they're self-reliant and they don't need anybody, but that's not really the case. And so then what happens to them when they're 17 and a half years old and they've got nobody, and then they turn 18 and they still have nobody? And that's where it hurts the most, because these are your kids who are going to grow up and be your workforce development and your people who are serving your food, but they're not going to be reliable if they don't have support and someone who cares about them, because if they don't care about themselves and no one else cares, it's not too hard to see why there's drugs.
thank you.
Thank you, Stacy, appreciate
Thank
it.
you. You guys have a good night.
All right, thank you, thank you. Next up, Veterans Advocacy Report by Counselor Janet Brecky. Just make sure you leave enough time for our last item as well as public input.
Good afternoon, council members. Thank you for letting me speak. I was looking forward to this because things happened rather fast, and I feel like I'm kind of on a roller coaster of activity and haven't had a chance to actually brief the council on what I'm up to. Basically, just to start with my presentation, what the issue is the need for building a community-based ecosystem in support of veterans. And what happened was through some emails from Jill Baker, who is the co-chairman of Community Action for Veterans locally, reached out, as well as Elijah Herring Blang reached out from National League of Cities, and Jill in emails about the opportunity and the need for local support from the elected officials to help with a nationwide effort. I followed up and found out exactly what that was that they were asking us to do, and found that it was something that I was extremely interested in, and probably, in part because my daughter's in the military and this would have a direct impact, but also it's something very easy to get a passion for. And so I contacted them, found out more about it, and said yes, I was willing to get involved and to try to serve in a leadership role as best I could, in the capacity that they're asking. So what happened then was they wanted me to attend a meeting in Washington, D.C. that was being pulled together by National League of Cities and National Veterans Intermediary. And so the first picture is who all they were pulling together, and it just shows you the different representatives that came to this meeting that I was coming to. And at that time, I was still pretty fresh on the issue, and so I really didn't know exactly what I was getting into. But what I found when I got there is that a whole lot of work had already taken place at the local level by Jill Baker and Steve Innes. They are the co-chairs of the CAV group, which is why Sioux Falls and South Dakota was invited to this meeting. And she's already done the kind of work that's been being recognized at that national level. And so they wanted her there because of the work she's done could be modeled not only for our city, but for our state and at the national level. So I learned all that when I got there. The challenge is that there are over 18.2 million veterans that live in our nation's 3,141 countries, and access to services that meet their needs varies from community to community because systems aren't integrated. And basically what you have here is a situation, you have 45,000 organizations that deliver veteran services, but the services themselves aren't necessarily trickling down to the veterans that actually need them. And the experiences that they're having vary from community to community, and the result of that is that there's some astronomical and frightening numbers that are happening to our veterans that has drawn it into a national limelight and become a national issue. And that is, veterans are committing suicide at the rate of 22 veterans a day. And these are, these are active service members, inactive service members, reservists, veterans themselves. That alone is terrifying. But in addition to that, there's nationwide, there's an astounding rate of homelessness and, and unemployment amongst veterans. So very sobering, very sobering issue. And this is, I put this up because what this really shows is what currently exists is creating a situation where the services more or less exist, but it's extremely difficult for them to actually get down to the individual needs of the veterans and their family members that need them. And I'm going to borrow Candy Hansen's plate of spaghetti analogy in the next slide, because that's exactly what you have here. You've got, again, this situation where it's not about funding, it's not about the actual services, it's about how do you unravel that plate of spaghetti and help our veterans. And so, the next slide will show you what has happened. And again, much of this is already in place, before I got there. And what has happened is at the national level, National League of Cities has undertaken this issue, and it started out with National League of Cities and National Veterans Intermediary. National League of Cities took it on because they have, they're an organization that's been around, probably the oldest organization of its kind, been around since the 1930s when cities, when railroads were being put across the country and cities needed a way to communicate as one so that they could speak together because of what the federal government was doing. So they've been around for years, and their program actually started with the municipal leagues. They have, I think, 9 states of the state municipal leagues are members of the National League of Cities, including SDML, from South Dakota. And then after that, it turned into elected officials. And they currently have, they represent 19,000 cities, towns, villages, which have a constituency base of 280 million people. So they felt they had the ability, if you think about this being a top-down and bottom-up grassroots kind of thing, they had the connections, they had the fabric to bring sort of a unified thing together because they had the relationship with states and local governmental officials. So they joined with National Veterans Intermediary, which is a fairly new group on the scene, but it's growing extremely fast. They are currently in 90 communities in 38 states. And they, I think, basically were developed in order to put something into place as this problem started to become, people became aware of it. They kind of are, I think their existence has come about because of identification of this problem and getting the service to the vets. And so things are happening very fast. And those are the two entities that come together and said, we want to solve this problem. And not only do we want to solve it, but we think that this is a matter of national security. Because if you're relying on a volunteer military force and the outcome is so grim for the future of those people, who would want to join, who would want to join that force? So with the homeless issue, the suicidal issue, and the employment issue, it is really a matter of national concern. So what they did, in addition to their coming together, they said, okay, how do you unravel this plate of spaghetti? And who they joined with then to help them with that is I've got Collective Impact Forum, and that's actually a process. The group that they align themselves with is FSG, which is a mission-driven consulting firm, and they use collective impact procedure, which is a new cutting-edge problem-solving philosophy that was designed by Stanford using a Bloomberg grant. So if you recognize that thing, that's kind of the same thing that the mayor's involved in. And RAND Corporation is a new, again, thought and leadership and data person. They're the organization that actually establishes benchmarks and then has they establish the benchmarks, and then they put in place the criteria to measure to see if the process that you're using is actually working. So you get those two together, and you have a brand new way of dealing with complicated social problems, and to make it more condensed, to unraveling that plate of spaghetti. So I've been, as a result of that, they wanted me to attend a webinar and learn about this collective impact procedure, which I'm terribly excited about, and because it can be applied across the board to all kinds of social problems. So having that training and being able to bring some of that training to some of my fellow council members can help us as we work through a whole myriad of social problem solving. So I think it's really exciting, cutting edge stuff. And when I saw that, I realized, okay, not only do you have two really extremely credible organizations coming together, but they brought two more organizations in that can really get the job done. And I'm just going to go a little bit further into, you know, this collective impact process, which I now know just enough to be dangerous, but am excited about learning more about, because it turns social problem solving kind of upside down from its traditional sense. And again, basically this just shows there's three kinds of problems, and the complex problem is the one we're looking at here. And basically what collective impact is a structured multi-sector approach to addressing complex problems. It's defined by a long-term commitment to a common agenda for addressing large-scale social problems. And what that means, I'll just kind of go a little deeper into it, but not too deep. You know, basically, when I say it kind of turns things upside down, the traditional problem-solving technique is to kind of recognize the key organizations that are doing the best and then fund those and let them serve in leadership roles. But when you have a whole lot of organizations, like in this case, 45,000, you know, trying to do the services, that doesn't necessarily work. You have a competition for funding and dollars, and you don't necessarily unravel the spaghetti. The right hand doesn't know what the left hand's doing. So what this problem-solving process does is kind of flip that all around. And so you come up with a common agenda, again, a shared measurement system, mutually reinforcing activities, continuous communication, backbone support. And the short version of that is you establish your criteria, then you have benchmarks for achieving them, and then you have the ability to actually study, you know, whether the process and the benchmarks and the assessments that you've put into place are actually working. And both RAND Corporation, FSG, and NBI and NLC said, we're in this for the long haul. We're going to keep developing the criteria. We're going to keep, you know, working on this until we get it right. So they don't see this as a short-term situation, but they see it as a long-term commitment. And again, just, you know, a little more about it. The Stanford group would say there's not a silver bullet. I kind of emphasize that part of it, but it's more of a silver buckshot approach. It's kind of a short way of explaining, you know, how this collective impact situation is going to work. And not to go into too much detail, but this next slide is really how it does work. And, you know, basically, if you look at all those little bubbles, it's a way of organizing things in such a way where you have a backbone organization, and then the little bubbles end up being all the collaborative groups that you work together with that have leaders. And then again, you're all following the same set of criteria. And I don't want to, again, I know just enough to be dangerous. The person who really understands this is Jill Baker. And this is why it kind of leads me to my next slide. She's got a whole PowerPoint, just understand, you know, this picture right here. But, you know, basically the reason that she is a leader in this situation is because she has actually already put together a CVEB, which is this Community Action for Veterans group, which is actually following this impact process. So we are light years ahead, and that's why we were one of the little dots on that blue map, is because she's got a process in place that just needs to further branch out, get the backbone organization, get these collaborative organizations, and do the work, and we could actually, again, be a model for Sioux Falls, for the state of South Dakota, and actually on the national level. So she is why I am here, is because they've gotten her involved. And what happened when I went out there, when I was at this meeting, is just before I had been out there, on March 5th, the president had signed an executive order. And so things were all abuzz when I got there on the 13th, because NLC had been meeting with the Pentagon and the president to try to figure out, was this executive order what they thought it was? And what they were hoping it was turns out to be what it was, which is that it's being called the Prevents Initiative, and it's basically the President of the United States has said, we got to do a better job of serving our veterans. And it's a message to Congress basically saying, you guys need to fund something that helps us do a better job of taking care of our veterans. So all of a sudden, right while I'm there, the word is coming down that you know, this is getting attention from the administration, and yes, this is a green light, and this is time now for NLC and NVI to make their political move. So as they're talking to me, they put two and two together, realized that, you know, I'm from Sioux Falls, South Dakota, and John Thune is our congressman, as well as Senator Rounds, who serves on the Veterans Affairs Committee and the Veterans Services Committee. And so they asked if I would be willing to front a phone call to those offices so that they could maybe get those senators involved on a national level. And of course, they were thrilled to find out in South Dakota we actually know our senators. I mean, that's kind of unheard of when you get to other states. And I said, sure, I would make that phone call. And fortunately, you know, Senator Thune's office got me in right away. And so we went up and visited with his office, and then they immediately got the other two offices involved, both Johnson's office and Governor Round's offices. There's something that they're very interested in being supportive of. And at that point, you know, I had just kind of acted as the introductory person, and now that has been turned over to NLC, and they are in direct contact with those people at the national level, because the next slide, there's also a House bill that was apparently put into Congress last year. It was run through last year, and it was turned down. And it would provide funding for just such an initiative as what's being proposed here by National League of Cities and NBI. But last year when it was proposed, they didn't know, there wasn't really anything in place. And so there was a lot of positive talk about it, but they didn't really want to get the funding in place before they knew where the funding was going, or was there anybody in place to actually, you know, utilize the funding. So it seems like the stars are aligning for NBI and NLC and RAND and FSG, because they're in perfect position now to say, okay, we're here and we want to do this, and we're in it for the long term. So what NLC was looking to our senators for was, you know, and House of Representatives, was who might possibly carry it on the Senate side or just support. And again, that's all up to them. I'm not involved in that national politics. My job there was to just give them the introductions. They'll figure out amongst them who is the best to actually try to carry it forward on the Senate side. But again, this was turned down last year, but there's real hope that, and they'll be keeping me informed as to how things are going with that. Because if this gets funded at the national level, what you'll see then is this whole collective impact process be a grassroots up movement and a top-down movement at the national level, with the end result being at its lowest level, you know, just every city, again, with all the cities in National League, municipal leagues all involved, you know, working, using the same model that they're using at the national level, so that you'll have a consistent set of services distributed to the veterans based on their needs, no matter where they live in the country. And, you know, hopefully, again, addressing those other issues that I talked about, the suicide, the homelessness, and the unemployment. So to date, then, what I have done is I'm going to be having follow-up appointments with Rounds and Johnson's and Thune's office, and we're trying to get Governor Noem's office involved, as well as we've notified Yvonne Taylor over at SDML about what's going on as well. So again, at that level, it's more of a just connecting people with the right, you know, at the national level, and then it's kind of working together, again, kind of sort of from the bottom up. So the final slide then is, again, this organization, Community Action for Veterans, that's an organization that Jill Baker, along with Steve Ennis, are co-chairs of, and that is an organization that has been created. It's called a CFEB underneath this new modeling collective impact model, and it's designed to actually, you know, deal with the issue, you know, locally, and again, hopefully at a statewide level. And again, she, you know, could give you a whole presentation on that. I don't think probably the full council wants that, but I have asked 3 other council members to help me on this matter. And I've asked Councilmember Kiley, Marshall Selberg, and Councilmember Starr to help me with this. And eventually we will, you know, take her training on this, and I hope, you know, some additional training, because again, just the advantage of being on this, they're going to give us these free webinars from the Stanford group that, you know, talk about how to actually, you know, utilize this. And once you have that knowledge and understanding, you can deal with a whole lot of issues with it. In fact, I couldn't help but think, you know, with the health issue, when she was talking about all those little, you know, had all those little logos. I mean, that's how you use that. So it's terribly exciting, I think. It's a great opportunity for our council to gain some additional knowledge and, you know, help us deal with some of the problems that we have to address. And then I do have one little correction. Chairman Yerksen had told me, I had mentioned when I went to this meeting, which again was somewhat, happened kind of, I had 8 days after I figured out I was something I wanted to do. I was there, I said it was an all expense paid trip, and it pretty much was. I should have, however, said all major expenses, because what they paid for was, the conference attendance, the meeting attendance, the plane fare, and the hotel. I did have a few incidental meals that weren't covered by the conference, and I had some cab fare and a couple baggage, two $30 baggage allowances I had to have in order to take a bag. So she did ask that because I got ahead of the game, usually that would be something I would have asked for before I would have left, according to our travel policy. I didn't really know, what those little expenses might be, and I didn't really think about those. So I am going to submit those now, but I did want to, explain it all to the council first. It felt like me for several weeks now that the cart kind of got before the horse. I mean, all of a sudden I'm doing these things, and it's just that was the situation I was thrown into because, quite frankly, like I said, a lot of work was done, but the stage that they were all at, the stage that NBI and National League of Cities was at, this was part of their plan. It was to get elected officials involved from the bottom up and the top down. And so they were kind of like in execution mode. And so it all just kind of, tumbled into place. And again, there were opportunities there for them with some key senators that happened to be ours. And so that's what I was all involved with. That's what I'm still involved with. There's going to be more involved with me now. And, from time to time, we'll let you know what we're up to. And I'll take any questions.
Thank you, Councilor. Any questions? Councilor Sale.
Yes, Councilor Bricky, thank you for your attention on this matter, and I look forward to the getting someplace. You mentioned that there's an average of 22 veteran suicides per day in the United States. Is that above the general, how far above that is the general public? How many suicides per day per general public versus veterans? That's the question I would have.
Yeah, I don't know. I think that's an excellent question. I don't know, but it just shocked me. I just found it shocking. I don't know. I could try to find that out. Yeah.
Okay.
Any other questions? Okay. Seeing none, we will move to the next item, budget priorities follow-up. Councilmember Teresa Staley, you are up.
Thank you, Madam Chair. This is just another stab at this. We had our first presentation on this last week, and first of all, I want to say thanks to my colleagues for your participation in this. It's something that I've wanted to do for some time now on my 3 years on the council. And this, in my heart, this was an effort to have a little more impact at the front end of the budget and get some brainstorming going. We heard tonight during our 2+ hour informational, we've heard from Mary Michaels in the Health Department, and she's talking about how I thought was impressive. She said their department started with 60 items that they thought were important, and they sifted it down to 7. So they're starting somewhere with things that are important to them. We also heard from Jessica, I think I'm saying her name right, Sexy? Okay. That she wants us to get feedback from our constituents when it comes to recycling. So it's all about listening and bringing that to the table. So this budget issue, I know we all hear from different elements, different aspects of Sioux Falls about priorities that our citizens have and maybe our own personal priorities. So we put together this brainstorming list. And let me also say that I'm certainly, moving forward, I'm open to suggestions to make this better next year, because I do plan to do this again. And I know Councilor Sale had indicated maybe there should be some kind of a monetary cost involved, and maybe that's something moving forward, Sean Pritchett, we could be looking at. If we come up with some things earlier on, we could throw that out to the finance department and maybe get an estimate. That is a little difficult to do in some aspects because, for example, we've got some broad-based desires like street repair versus a specific project and repairing a pool or putting up some coverings on bus stops. So that's something I think would be cool to look at. But again, as a group, if there's something that makes this more effective, that's great. So what we did for this week is Dave Bixler, our budget analyst, took all of our, we put this together a month or so ago. We kind of threw out all the things that we thought were important that people wanted to volunteer with. And then, and I've put this on Facebook because I want the public to see what we were talking about here. And then I'm just delighted that we had 8 people participate in this, but we ranked, we just voted and on 10 priorities, and he just took them on equal weight. So just quickly here, so the public sees this, street repair, 6 votes, top of the list there. Of course, we're always hearing people want more energy put into that. The triage center, 5 votes. Renovate and repair Frank Olson Park, that got 3 votes. The State Theater funding, give energy, 3 votes. Discovery District, we give that money already, 3 votes. Affordable housing, and there again, that's a hard one to put a price tag on, but 3 people said, that's a big priority for us. We want to continue to work at that, and we just heard about this housing summit, so that is a priority of the mayor's as well. Keep and maintain Keene Park, 2 votes. Arrowhead Park salvage and donated the house there. They want some renovation there, 2 votes. Project Trib, one of my pet projects, got 2 votes. And funding to increase the number of neighborhood associations, 2 votes. Homeless Issues Warming Center, Bishop Dudley, 2 votes. I'm just going to name the 2 vote ones. Glory House, 2 people said let's continue to support that. Here's one, what's the city's role in addiction suicide issues? See, it'd be hard to put a price tag on that, but 2 people said, let's give some more thought to that. 2 people said something about the event center complex. I'm not quite sure what that one was. 2 people thought transit needs to have some added financing. Somebody thought that we should have 3 attendees to the National Congress of Cities. 2 people. Address the flood issues, 2 people. A new pool, and it just throughout town, 2 people. And then there's other things that got 1 vote after that. So I just want the public to know we're trying to be proactive in giving some direction to our finance department. And again, I just appreciated participation, and I think the discussion was a good one.
Any questions, comments, anything? Okay, we will move to, thank you, Councilor. We'll move to public comment. Is there any public comment on any of the items that were presented today? Going once. All right, we are adjourned. Thank you.
Going twice. Who are these?